So what is Obamacare and what does it mean to us? This is the Affordable Care Act that was passed in 2010. Did we really get what we bargained for at the beginning when everybody wanted universal health care so that everybody could have insurance at a price that would be affordable? And the answer to that was absolutely. But until the time that actually the rubber hit the road, there was a big change in what happened when we actually voted on what Obamacare would be like. And the document itself was 2,700 pages long. It's not understandable. I've tried to read it, and lawyers have a hard time reading it. So there's a lot in there that's open for interpretation that I'm sure is going to be an issue at some time. But it didn't give universal health care. It did give us some things, however, that are worthwhile. It's supposed to provide more access to health care for people who can't afford it. And it will do some of that. And it's supposed to rein in costs, and it will do that as well. It's also supposed to have consumer benefits, which it does, and we'll talk about that. And it's supposed to pay some attention to wellness and prevention. It's true, it does some. And when it comes to insuring people who are uninsured, which are those people between Medicaid, which is welfare insurance, and people who have private insurance that they pay for either themselves or through their employer, a whole different story there exists. Those people who are uninsured or underinsured make up about 50% of America. So this is a huge issue that affects 50% of everybody who lives in this country. And when you see something like that, you'd like to see something happen that really gives genuine health care to people. And some of the things we talked about are true. And there's not going to be any further problem with caps on insurance, meaning that if you have an illness, an insurance company is not going to be able to drop you in the middle of the illness and say you've used up all your money. There won't be any rescission. That will be outlawed. That means that, for example, you had breast cancer and you had paid your insurance policy for 20 years, and all of a sudden your insurance company, when they found out you have it, sends you a notice and says, we're not going to insure you anymore. And you're wondering, you can't do that. And they say, fine, sue us. They've got the money to defend. You don't. They also are going to limit any kind of exclusion for pre-existing conditions. Another big thing. And you won't be rated for it. There's not going to be an increase, okay, in what your premiums are going to be because you have a pre-existing disease. And lastly, there's going to be some prevention, but it's a modest step forward, but it still is a meaningful thing. Now, the provisions of the Affordable Care Act mean basically is we're going to have the same premium for just about everybody. That's good. The individual mandate means that we're going to have to all have insurance or we'll be subject to a fine starting January of 2014. However, the way that we enforce that is going to be a lot different than if you're going to have your wages attached, for example. The only way that the IRS can collect on that is if they owe you money. Then they'll withhold all that money that you should be getting as a refund against whatever it is that you owe for insurance to the government. There's a sliding scale subsidy, which means that if you're relatively poor, you're going to get a bigger amount of a subsidy from the government that's going to pay for a large part of your insurance. However, there are subsidies all the way up to $92,000 a year for a family of four. And of course, there's a sliding scale in between. There are going to be health insurance exchanges. These are going to be formed by the states. They will be managed by insurance companies who will come together, and their responsibility will be to teach you about what their insurance policy will be. But the state will be examining those companies and what they offer, and not all will be accepted. So, for example, in the state of California, in 2014, several companies were not included, and they're major companies like Aetna and United Health. So that's another aspect of it. There are going to be navigator programs which are made to try and help you understand what the insurance program is all about. And if the states want to opt out, they can. But the problem there is the government's paying the vast bulk of the policies that the state would have to otherwise pay in their own Medicaid policies or policies like that. And it's attractive for them to be able to get government to pay for that. It's up to 90% for a while. By the year 2020, it gets more realistic and the states will be sharing more of it. It's much like what happened to Medicare in 1965 when it came into existence. Only a few states took it, but within the next 17 years, all 50 states agreed that it was in their best interest. One other thing that's going to happen is there are going to be electronic medical records, which means that your doctor will be able to get information from other doctors and hospitals and all kinds of doctors who have been taking care of you at any time. So your medical records will be secure and they will be accurate, and that's a big plus. However, they're also going to have problems with this too, because the medical records are going to be shared with the IRS and with other agencies that will have, like HHS, the Human Health and Services, and even with the government that's looking over our shoulder, like with Homeland Security. That's a big problem. And for doctors, it's a real challenge because now one-size-fits-all medicine is going to be what comes into existence. If your doctor wants to try some new unapproved therapy, which might be legal in some states, the government may not approve of it, and if they don't, they will not reimburse for those services. The next step will be is if you continue to do that, they will probably fine you, and they have, of course, the ability to see that your license is removed, and if you continue to do what you're doing, you may even go to jail. So there are a lot of things that come with these medical records that are electronic that are a real problem for us. Now, when we look at the individual mandate, that insurance, as I said, comes active in January 2014. There's going to be private insurance, government insurance, employer insurance, and exchange insurance, which means that you'll be able to get a policy. But the question is the devil's in the details. Will you be able to afford it? Let's say that you're making only a little bit of money, but you can't quite qualify for Medicaid services, which means you have to have private insurance and it's required by law. Then what will happen is you will have a choice of 4 plans. 2 of the plans are rather expensive. The one that's the most common is called the Silver plan, and then the least is one that is much less. It's the Bronze plan. And so the problem with these insurances that you'll have if you don't have a whole lot of money is that even though they're going to provide you with some benefits that are great, there are going to be problems with the policies because they have large deductibles and they also have copays that many people on the salaries they're making will not be able to afford. And then there's a question of, will doctors actually participate in Medicaid programs? I can tell you today, very few do, because the amount of money that they make from programs like that is very limited. So what we have is something that is very challenging. It's a start. It could turn out to be half decent. And there are reports like in the New York Times from Saul Krugman, who says California is going to lead the way, and maybe it will. I happen to have a lot of faith in Jerry Brown and think that if he would bring something like that forward, that it's probably going to work. But we'll see. The proof is in the pudding after the first year. So who are the winners and who are the losers? Basically, we've got 15 million people who will qualify for Medicaid now, and people who are making up to $92,000 a year for a family of 4 will get some subsidies to help pay for insurance. Kids up to age 26 will be able to stay on their parents' insurance program. And of course, older people will pay less because they can't afford generally to pay a lot. A lot of them can't. And a lot of that burden is going to fall on the youth who are also going to be required to be paying for health insurance that they're probably not going to need. And who are the people that are the losers? You're looking at hospital employees. There'll be a lot of budget cuts, and you're going to find out that MDs will be making less. There's going to be more paperwork. Medicare is going to be giving up some of its money to Medicaid to fund it. And of course, we're talking about HHS, the IRS, and Homeland Security now having access to your personal records. So there are a few problems that we're facing with the Affordable Care Act. The high deductibles and copays. We also have the amount of money that you make is going to be on a basis of modified adjusted gross income, which means that your income will be inflated a little bit because you can't use the deductions that you have for your home or other kinds of expenses. You're going to work on your gross salary as the amount of money that's figured that depends on what your subsidy will be. Insurance is going to have be very limited because MDs are not going to be so available. Funding from a lot of Medicaid is going to come from Medicare. There are going to be more politics involved in Congress, which will probably result in more bribes and kickbacks. There's a major invasion of privacy. And of course, we're not really shifting the paradigm from disease care to health care. So there are pluses and minuses. The question that comes to my mind is, why did Obama wait so long to act on the Affordable Care Act and on all the health care reform? When he had control of both the Senate and the House of Representatives in Congress, it would have been straightforward to pass whatever he wanted. But he waited, and ironically, the person who supported this the most, Ted Kennedy, died, lost his seat, went over to a Republican, and now we're sitting in a place where we don't any longer have that kind of control, and that's why a lot of these concessions were made. You have to ask yourself, why did that happen? There must be reasons, but they disturb me. So the Affordable Care Act, going to do some good things, some bad things. We'll find out about it over the next year. It's too complicated to really understand now. Let's just keep our fingers crossed. Maybe it's going to do something to help more people in ways that we can continue to improve over the years.